What about aging of the midface? We'll work our way down a little bit. As we age, we do develop a malar crescent or nasojugal fold and a nasolabial fold. And the anatomic correlates of this are loosening of the orbicularis muscle and the related orbitomalar ligament and the descent of the cheek fat pad or the malar fat pad. In order to rejuvenate this, we would need to do what's called a midface lift. And with a midface lift, we're lifting those soft tissues of the midface, namely the malar fat pad and the orbitomalar ligament area, superiorly. There are several techniques available to do this through the open approach, involving variations of incisions underneath the eyelid or through the inside of the eyelid. But what we'd like to do is develop a technique that has fewer complications. One of the problems that can happen with those other techniques is movement of the eyelid downward, or ectropion, or retraction. One of the simpler techniques which has been introduced, which I find quite interesting, is the percutaneous cheek lift technique. With this technique, a small incision is made in the hairline, in the temporal tuft, as shown in this diagram, and 2 needles are passed with Gore-Tex sutures through the mid portion of the cheek and passed superolaterally into the temporal area and sutured, raising the malar fat pad superolaterally. With this technique, you can have reduction of the nasolabial fold. This is a nice technique because it can be done under local anesthesia. A slightly more involved technique is the endoscopic midface technique. With this, we use similar equipment to that used for the endoscopic brow lift. What we're doing now is dissecting down onto the bone of the, over the malar eminence, from superiorly and inferiorly up inside the lip. And then a variety of different ways can be used to fasten that soft tissue periosteum superiorly. One of those methods is that developed by a company called COAPT, and I should say right now I have no interest in this company, but this is an interesting device I'd like to mention. This device is called the COAPT Endo Midface Lift device. It's an absorbable, essentially tacking hook that's placed into the periosteum of the midface, passed superolaterally out through the incision in the temporal tuft. This is an example of the device right here. With this device, the midface soft tissues are raised superiorly, and this device is fastened to the deep temporal fascia. This is an example of a patient who had this performed elsewhere, and this photographs were provided by COAPT, but we see here nicely an example preoperatively of the malar crescent and nasolabial fold area, and postoperatively these areas are much improved. Again, this is a relatively easy to undergo procedure, can be performed under local anesthesia with some IV sedation, and does improve the areas to be addressed. Who's a candidate for a midface lift? These are generally younger patients, patients who, quote, aren't ready for a real facelift. These are patients usually in their late 30s, mid-40s, with isolated midface ptosis. The midface lift does not really work well on the neck or the jowl area, so the patients with no lower face issues would be good candidates.